So if you're watching this, you most likely have Achilles discomfort, pain, tenderness, and we're going to show you some exercises, some stretching, but some strengthening things that you can do to make that Achilles much stronger, less irritated, and more comfortable. But we need to talk about why the Achilles may be aggravated and inflamed, and often it can occur due to a misalignment of the lumbar spine, but of the pelvis as well. That pelvic unleveling, transferring stress further down the body, and unfortunately at times the Achilles has to cop it and work harder than it needs to. So where is your Achilles? What we're going to be working on today is this tendon here. It's right at the heel that goes up through the calf, links that muscle to the bottom of the foot. What can happen is that nice strong Achilles can get inflamed and it can cause tendonitis, sometimes tendinosis, where there's little tiny tears in through the tendon, and worst comes to worst, rupture. This is nasty and horrible, but what we're really going to be working on if you're being prescribed these exercises is most likely tendonitis, and at worst tendinosis. So I'll show you a few exercises now to help decrease inflammation and improve strength. So this will seem a little bit strange because I try to position the camera. What we're really going to work on first is releasing the muscular tension and irritation through this Achilles tendon. And the best way to do that is to massage it yourself. It's not incredibly comfortable, but it's incredibly effective at breaking up those muscular adhesions. So just with a pincer grip, you can work along your Achilles just like this, pinching it, finding a tight and irritated spot, holding for 5 to 10 seconds, and then releasing, working further down the muscle, 5 to 10 seconds, just a light pinch, and then releasing. That's going to help get blood flowing there, breaking up the muscular adhesions. Once you've done that, something that you can then turbocharge it with is, we're going to pretend that this whiteboard marker is a piece of ice. It's called a cross-friction ice massage. Simply getting an ice cube. I usually get patients to put them in like a snap lock bag, so that way the water, when it melts, doesn't go anywhere. But holding the ice cube, you're going to rub like this all along the Achilles tendon, go sideways, up and down. You're going to do it on this side, but you're also going to do it on this side here. Similar thing. Apart from breaking up the musculature and the tightness, it's going to help decrease inflammation by cooling down that inflamed ligament and tendon. So the next exercise you can do, which is really great at lengthening and taking that compression off the Achilles tendon, is using a TheraBand like this, just a stretchy one. You can get them at Kmart for a few bucks. We sell them even cheaper here. But simply sitting upright, getting the band along the base of the foot there, move back. And then with the band, you can pull, and it will generate some tension and stress here to stretch it. But what's even more effective is taking that to tension and then pushing the foot down like this against the resistance and coming back, pushing down like this and coming back. Apart from stretching it, that's really going to help strengthen it and allow it to have that stability, so that going forward, when you do put weight and load on it, it's not going to flare up and be so inflamed. So the next exercise we're going to show you is a soleus stretch. That soleus muscle is the big muscle which the Achilles links onto and then down onto the heel. By stretching this out, once again, just affords more relief through here. When doing this stretch, it's often done incorrectly. So with one leg stepping forward, keeping this back leg behind, and then leaning forward. But what a lot of people tend to do is they lean forward and the heel comes up. That's when you lose the clinical effectiveness of the stretch. So what you would like to do, what we'd like to see, is stepping forward, keeping that heel planted, but when you lean forward, really keeping that heel there, leaning forward for about 30 to 60 seconds at a time, and repeating that 2 to 4 times a day. It's just going to help lengthen and ease the tension for that soleus and Achilles. The last exercise we're going to show you is often done incorrectly. People treat it like a calf raise, and while calf raises are great for building up the posterior calf muscles, what we're looking to do is focus primarily on that Achilles tendon. So finding a step, a ledge, anything that's going to get you into an elevated position. I'm just going to use this little block. Often what people will do, they'll put their toes here and then they start the exercise straight away, pushing up and then lowering down. That's not what we want to do here, because we primarily want to focus on this. So coming onto the block, you're going to stand with your toes pointed straight away, and then it's all about gently lowering, not only to the horizontal height, but dipping down below. Ideally, you'd have something a bit higher than what I've got, but repeating that 10 to 15 times, toes on, and then gently dropping down, and then going even further down with your body weight. It's just going to help get that perfect change in through the Achilles there. So those are the Achilles exercises for stretching and strengthening. They're great for anyone that's got those sort of heel and ligament pain and discomfort through the back of the calf there. Have a go at those. If you've got any issues, when you come in next time, speak to your chiropractor and we can advise you appropriately on whether we need to make any modifications or pivot with some different sort of stretches or strengthening.